Nelo is a reusable, non-sterile Class 1 medical device. It is both a universal surgical patient positioner and a pressure ulcer prevention device or a pressure redistribution device. Patients are at risk before they go in for surgery. Under general anaesthetic, patients are immobilized, so it means they can't move or reposition themselves. And they're vulnerable, they're at risk for getting pressure ulcers and nerve damage if they're not positioned correctly. This is a huge burden on the healthcare system. It's predicted that it's 4% of annual healthcare budgets in Europe alone is addressing pressure ulcers, and this is a shame because it's largely preventable. Nelo is composed of cured medical grade silicone and silicone polymer, all encapsulated in a polyurethane film. So both the grey and the neutral film have a soft haptic feel and this silky feel which is really nice on the skin. Underneath the neutral film we have our traditional medical grade silicone. This silicone is found on all our pressure care devices, so it offers the same anti-bottoming out features and pressure redistribution performances as a standard operating table. Underneath the grey film we have uncured silicone polymer, and this gives Nelo its malleability. It's versatile, it's reusable, it's easy to clean, it's lightweight and it's easy to maneuver. The design of Nelo was heavily influenced by our breast care technology. So we kind of cross-pollinated between the two families, leveraging decades of experience in breast care technology, materials know-how and processes expertise, and brought it over to the pressure care side of the production floor. We wanted the designs to be symmetrical. We wanted the weights to feel natural for healthcare professionals to be able to fold, roll, stack and mold Nelo. Designing for versatility meant we wanted to avoid restrictive features or specific configurations of use. Healthcare professionals can nest the anatomy into Nelo, or they can sculpt and contour Nelo around the anatomy. Designing Nelo and the development of Nelo didn't come without its challenges. Bonding and working with really thin polyurethane film, less than 100 microns, can be challenging. On site we have heat welding, we've radio frequency welding, ultrasonic welding, and it was all about optimizing that weld strength, bearing in mind that these devices will be used under load, under bony prominences during long surgical procedures. Our quality management system incorporates ISO 13485, the MDR and the FDA. So this extensive range of quality regulations meant we had to do exhaustive tests, including pressure mapping, tensile tests, compressive tests, fatigue tests, chemical degradation tests, to make sure that the device is safe and effective throughout its lifetime. Nelo is the perfect addition to TruLife's pressure care range of medical devices, and we're really looking forward to putting it in the hands of healthcare professionals.